Good morning. I'm Commissioner Christian Leinbach, and I want to welcome you to our operations meeting for November the 12th. We're broadcasting live on Microsoft Teams live event. We're also in person. And at this time, I'll recognize my executive assistant, Anne Marie Grill, to read the public comment policy.
Thank you, Commissioner Leinbach. Public comment will be accepted in person and through the Q&A function. Please include your first name, last name, and municipality for all comments. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used. In-person comments will be accepted first, followed by comments submitted virtually. The meeting comment period is limited to a total of 30 minutes, including both in-person and virtual comments. This time period may be extended at the county's discretion. Please be concise. Comments that are germane to county business will be read during the meeting and should not be considered to be interactive dialogue. The county shall be the final arbiter of whether a comment is germane and should be read. Any response to public comment will be done at the county's discretion.
Thank you very much. No public comment on agenda items in person, none online. We have one item on the agenda today, and this is the opioid settlement update. We have Stan Papadimitri here with us. He is the fund consultant. Many of us know him as the former director of the Council on Chemical Abuse. So we'll turn the meeting over to Stan. Good morning.
And thank you for having me here. I don't want to take up a whole lot of your time, but I thought it was important. Kevin and I, as we speak on a regular basis, thought it was important to give you guys an update. So I've been here a few times before and gone through the settlement in much more detail, and I'm not going to do that today because there's no need to do that today. But I always find it important that if we are in some kind of public forum, to at least kind of hit some of the highlights of this, and then I'll get into some of the meat of what I want to talk about. So, opioid settlement 2022 was a national settlement. Pennsylvania got somewhat over $1 billion, and I'll get into what Berks County's monies are as I go along here. But this was a settlement money. It's not government money, and it's very specific. Unlike the tobacco settlement of several years ago, where they just gave the money to the states, and year one money went towards tobacco activities, and after that it went into roads and bridges and all kinds of stuff. They wanted to make sure that this money went towards what it was intended for, and that was opioid disorder and overdose remediation. So it was very specific in the settlement that the monies go towards treatment, prevention, and other strategies to remediate opioid issues. No money for admin costs, and it had to be very specific within there. And there were two different appendices within what they call Appendix C of the settlement, A and B, and A was very kind of not very specific at all, very kind of broad, and B, while a little bit more detailed, was still kind of broad. So the challenge that we had from the start was, you know, how do we interpret some of what you're allowed to use this for? As part, like I said, this money is outside the purview of state government. There's a trust that was set up, and they're responsible to manage the money, to invest the money, to issue and review reports that come back from each individual county. Counties would get an allocation, and again, I'll go through Berks counties in a moment. We had our first report. We had our first payment back in August of 22. Our first report was due in March of 23. Thank you. Yes. There's a lot of dates here. And we submitted 29 programs to the trust, and we did pretty well here as Berks County because they only questioned us on 2 of them, and both of those questions were really just detailed questions. And we just had our second report submission a few weeks ago, back in September, and I think Kevin and Cody and myself each got an email that they wanted a little clarification, but other than that, we're doing fine in terms of the programming that we're doing here in Berks. Okay. This is the total amount Berks County is getting as part of, and I'm calling it Wave 1, or it's being called Wave 1 of 2022, and that's a little bit more than $13 million. This is going to be over 18-year period. It's not an even division over 18 years, but it's divided over 18 years. And this does not, the district attorney was part of a separate suit, and Berks County District Attorney gets his own settlement money. This does not include his funds. Recently, we were made aware of Wave 2, or given more detail about Wave 2 of the settlement of 2024, and that's going to be $11 million that comes into Berks County. That's going to be over a 15-year or 15 payments. Let me say it that way, 15 payments. And again, this does not include district attorney's funds, monies. So over the course of 18 years, Berks County will receive $24 million for opioid settlement, opioid remediation, which is good. I mean, obviously, it's always good to have more resources available to address the issues, and I don't have to tell this Board of Commissioners that Berks County was hit hard and continues to struggle with overdoses and opioid issues. So Wave 1, and I have listed there the various payments we've received for Wave 1. September 22 was $538,000. I won't go through all the numbers, but each payment is for an 18-month period. And that's important because if you don't spend your money in 18 months, you either have to give it back or request an extension. So these are the dollar amounts that we've received, and we're anticipating, we got notification that in December 18th of this year, we're going to receive probably the largest amount from Wave 1, which is $1.134 million. When we got the notification back in August, I believe it was, I keep looking at Cody because I know he gets this. When we got this notification back in August, we didn't hear about anything definitive for Wave 2. We knew that there was a Wave 2 out there. We knew there was going to be, like, Berks County was going to get another large pot of money, maybe not as large as Wave 1, but another large pot of money. But they didn't include that. We thought that would be included as part of what we were going to get in December, but we didn't hear about that until probably like 2 weeks ago, 3 weeks ago. And they told us that the payment, the dollar amount we're going to get in December of 2024 is almost $3.3 million strictly for Wave 2. Now, this includes payment 1 and payment 2 within the Wave 2 structure. I don't want to get too complicated with that, but the bottom line with all this, in December, Berks County will receive close to $4.5 million of opioid settlement money, a combination of Wave 1 and Wave 2, and we have 18 months to spend that. And it has to be through that pretty specific or tight window of the settlement cost, what you can spend settlement money on. What we're hopeful of and what I've heard, and there's been nothing that come down to as official yet, is that the trust may allow for a 40-month period for that Wave 2 money, which would allow more than 18 months, because that's a lot of money to be spent, and being careful that you don't start something and then year 2 you're just not going to have the money for. So there's a lot of discussions that are going to need to occur at the county level. And like I said, this is pretty new, and Kevin and I have just started talking about some of the things that might be able to be done with this. And we'll just wait until we have a chance to kind of discuss that, and I'm sure Kevin will discuss it with the commissioners. So now to the graphs. Okay, this is Wave 1 monies, and if you see, I told you that it's not an even distribution, and as you look at that, this is Wave 1, and the red marks there are what we've already received. The gold mark is what we're going to receive in December, and the other marks are what is anticipated all the way out to 2038. You see it kind of, this year is high, next year is fairly high, then it really dips down, and then it kind of goes up, and then it flattens out near the end. When we look at Wave 2 money, that's year 1, and then it's a steep ski slope down. And then we kind of flatten out there to the end, which we anticipate that to be 2037 or so. So what does that mean in total? This is how our money is going to come in over the next 15 years or so.
Ooh.
This year it's a lot, then it dips down, and then it kind of waves out. So it's, again, from my perspective at least, a lot of money that's coming in. We could probably go out and start a lot of programs, but I think as a county, you need to think about that, because in year 2, what do you do with, or year 3, where are you going to go with all of that? So, yes.
So do they have any suggestions? Because I'm glad you did these charts. The charts really give you a visual. That's a huge sum of money to spend in a short period of time. What suggestions, if any, did they provide?
No.
None.
So actually, and I didn't realize that for wave 2, I didn't realize they were combining the first 2 payments to give to us, which then actually helped our total. We were just seeing some discrepancies in some of the spreadsheet numbers, and we contacted them and said, oh yeah, you get payment 1 and payment 2. That's when I found out that, well, they're looking at possibly a 40-month kind of time period, which is nice. I mean, that's 3.5 years that you can spend some of that money. But look, there's options. Maybe there's some infrastructure options and some long-term contracting options, but we need to look into that. Again, this is fairly new information that's kind of come to our plate, but I think it's important for the county to know that a lot of money coming in a month, and the clock starts ticking on the 18th to spend it. So right now, the money's going towards pretty much these types of services. Probably the heaviest hitter out of all these is the MAT program up at the jail, which is a good program. It's the medication part, and then there's a case management component that goes along with it. We put a significant amount of money into recovery house support, both criminal justice as well as community recovery housing. There's some workforce development. We've had really good work coming out of Connection Works. They're doing for the recovery folks what they've been doing for the criminal justice folks for a bunch of years, and that's taking people in early recovery from opioid use disorder and helping them develop job skills and finding jobs and those kind of things. We find that extremely useful, and quite honestly would not be able to pay for that without these monies. Then information dissemination, we're doing a significant amount of that. I think Mike is part of SOS Berks. You know, like you have the Response Magazine coming out, Apollo, and some stuff with other media kind of programs, as well as Berks First. We're doing some stuff with Berks First, making sure that we're getting information out there. And actually Berks First is good because it hits every household, and we're able to get information out there, which is really good. And sometimes people just flip through and say, oh, here's a number. Maybe I can just call that number and find out some more information. And we're also doing some family education support programs out of this for family members of folks who have an opioid use disorder, whether it's some educational stuff, as well as working with some kids and some bilingual programs there. So in my opinion, there's a nice kind of mix of how this money is being spent. Obviously, the higher end the higher end costs are treatment and those kind of things. But again, it's a nice mix. The last thing I just wanted to kind of mention with you all is just one of the things we've been discussing recently, Kathy Noel, Kevin, and myself, has been the project approval process. From the outset, pretty much the process has been this. Proposals were submitted to COCA. We reviewed them. Pretty much I reviewed them and I looked at them with the eye of, does this meet criteria of the settlement? Because if not, then you can't fund it. So we would just get rid of that. And does it meet kind of the goals of what the county is looking to do? So there would be initial screening of that. I would do that with Kathy, and then we would meet with Kevin and say, hey, here's some proposals that have come in. Here's what we're thinking of funding. Here's what we're going to say thanks, but no thanks to. And then went ahead and contracted. Everything's run through COCA. So their board of directors approves the contract. And it was a pretty tight process in the sense of it came through COCA, and we had our county connection there, and we made some decisions on where to go. And I think the proof that this was a pretty good process was the fact that unlike most other counties, Berks County was found to be good or a model in terms of how they chose counties in their process for going up and doing things. And I believe it was important, especially early on, since this is all uncharted territory. Nobody knew what this meant. I mean, nobody knew how you can spend money. Nobody knew the rules. And it was kind of, I'm not going to say it was being made up as it went along, but we had to find out clarification as we went along. And sometimes that took some time. So recently, again, with Kevin and with Kathy, we were talking about this kind of getting kind of a little bit more expansive in our process. So pretty much it's going to look the same to start with proposals. No, actually, first what would happen is there would be determination by the county in COCA, and we would sit down and say, here's the monies available to us. And as part of that, what are those priorities that need to continue to be funded? The big one, of course, is the MAT program at the jail. So, okay, so let's make sure we have enough funds for that. And whatever other programs are decided, and that could be a year-to-year thing, but each year there's a decision made in terms of what are those priorities. Okay, how much funding is left over? We take that, we put it out on an RFP, put it out to the community and say, here are these monies, here's the time period, here's the things you can do, all that kind of stuff. Proposals will come back into COCA and we would do a very similar thing. Let's take a look at these things. Do they meet Appendix E or not? And then from there, and here's the new part, we would put this, we would then send those to SOS Berks. And then they would set up their process, and Mike, I'm not quite sure what their process would be just yet, but they would set up a process of then they would do a screening of these. They would review these and they would prioritize these. And then from that, they would make a recommendation back to the county / COCA and say, here's what we recommend for contracting. And then again, that control would still be at the county level in terms of what would get funded and then go through the contracting process. So we have been talking about this probably about 4 months, maybe a little bit longer. Kevin thought it was important that we bring it to the commissioner's attention that we're looking at changing this approval process, not terribly different other than we're getting some more public input. So kind of in recap, a lot of money coming and we're changing the way we're looking to find and approve programs for these monies.
I think the addition of SOS Berks as a review is critical to the success of dispersing this money. And we have to find every opportunity. We have to look under every channel. We don't know if we've reached all of the opportunities in the community. We have to find more ways to get the message out for people to respond to an RFP and make proposals to us and to COCA, because there's a lot of money in this spike. Hopefully we're granted that 40-month opportunity. As Stan said, we'd probably have to look at extended contracts to cover that amount of money over a 40-month period, but it's a big challenge. I mean, it's a challenge we're glad we have because this money's going for all the right purposes. But at the same time, we want to make sure that every treatment, every prevention opportunity out there is fairly submitted and reviewed. And we don't know if we hit every one of those the first 2 years we've been in this process.
So, and if I can just, something I forgot to say, because I make notes, but that the medical assistance retraction, which you all may be aware of, there's people that are no longer eligible for medical assistance. What that has done with COCA has really increased the number of people knocking on their door, looking for their money, for their dollars for treatment and recovery support services. In fact, when I was speaking to Kathy last week, she said there was a 23% increase on the knocks in their door, which can be attributed to those folks would have gone in, they would have had their medical assistance cards and they would have gotten service through that avenue. Now it's coming back in here. So some of these monies would have to be thought of there in terms of making sure that the treatment support that's available in the community is still there. So there's a lot of moving parts here.
I want to reemphasize, whoever might be watching this or listening, this is not for individual services. I think in the past we received requests from people individually. That's not what this money can be allocated for.
But just on for those that don't know what SOS Berks is, it's a opioids coalition. It's made up of different providers. We have different county departments. We have people from the community. Our healthcare system is involved in that as well. And we meet on a regular basis. There's 5 different committees, and they work. COCA plays a huge role in SOS Berks and the staff and the work that they do there. So SOS Berks is a coalition made up of different key stakeholders that want to deal with the opioid crisis here in Berks County. I think it's a great step to get them involved, because that's what they do on a day in and day out basis, the members of SOS Berks. And I do hope we're able to get that 40-month extension. I mean, it's what, 4.4 million, then it goes down to an average of about 800,000 per year. You don't want to start a program or just say, well, you know, we have to use the money for something, so let's use it for something, without looking at the long-term impact of it. So hopefully they will see the benefit of doing it for the 40-month to make sure that we'll have 3.5 years to be able to use that money and have long-term programs that will be able to have a positive impact on the opioids use.
A couple of items. I was involved in discussion recently on homelessness. And one of the issues that came up is validated programming. And here's the example was there are some entities that with all good intentions want to help the homeless, and they're taking them tents, they're taking them food and things like that. And it's not changing the actual ground zero reality. They're still homeless. And I think it's going to be critical that public entities, organizations that are interested in this need to come forward with validated treatment. If they're looking for money for a program, we're not going to be dumping money into something that isn't already proven, that isn't already validated, that it actually is addressing the challenge. I agree with my colleague, and I'm sure all of us do, that chunk of money that we're getting the end of this year, we need an extension so that we use it in the most appropriate way. The second thing, this reminds me very much of the ARPA money, where you have a significant amount of money. We have a longer time span, but I think it's important as we fund various programs that people understand, like we told them with ARPA, there's an end to the funding. Even if we end up funding them on an annual basis until 2030 or 2035, when that funding ends, there isn't a source of funds from the county. The county historically has not put money out for nonprofits in general. And the reason I raise that, I still am getting calls about, can the county fund this or county fund that? They're not necessarily asking for ARPA money because they know it's gone, but they'll reference projects that were funded by ARPA, and why can't we fund them? So we want to make that very clear. This is money, and while it's over a fairly long period of time, it will go away, and it's not the kind of money that we're going to ask our taxpayers to come up with and fund various programs, no matter how good they may be.
Yeah, so if I could just add
Sure.
a couple comments after. So your first point about valid programs, actually the settlement calls for evidence-based or evidence-informed
I
programs.
was trying to think of the word and I couldn't, but validated worked.
Yeah, that works. So, I mean, that's built into it, which, I mean,
Right.
which is good because people have great ideas and it comes from a very good place, but it doesn't necessarily mean it's going to be effective.
Right.
And then the other part of it is when we ask people for concept papers, one of the things we ask them for is, well, what are you going to do when there's no more of this money? Because I don't think any of us are really enthusiastic about funding something for a year or two and then just have it go away.
Especially if it's successful.
Yes. So what would you look to do? So I mean, no one has a crystal ball and say, well, I'm going to get a federal grant or I'm going to get a this or that. But, you know, we let them know up front that this is not a forever.
Okay.
That's all I have.
Thank you.
Thank you.
Thank you very much, Stan. Thank you, Kevin. I know that you've been very involved in this from the COO standpoint, and Cody. Okay, Kathy's name is on the list here, and I saw she's not here, but Cody, thank you for
Keeps us on the straight
your
and narrow.
involvement. It keeps them legally
Compliant.
compliant. Very good. That's all that we have on the agenda. Is there anything else? Any public comment?
Motion to adjourn.
The meeting is adjourned.